Can you see over there? There is a photo hanging on the wall. It's a beautiful painting. Wow. No, it's a big eye. No photo. An eye. So in this video section, we have learned about a symptom of schizophrenia, that is hallucination. So what do schizophrenia means? Schizophrenia is a mental disorder. Going more specifically, it is a psychotic disorder. Schizophrenia is made up of two Greek words. First is schizo, which means split, and second is phren, which means mind. Schizophrenia means split mind. So what does split mind means? Split mind means when the person who is schizophrenic could not differentiate between what is real and what is not. Means he could not split his realities and fantasies. The symptoms of schizophrenia vary person to person. In some, it can be severe, and in others, it can be moderate. When the schizophrenia just appears, its symptoms usually comes in a severe form. Schizophrenia is a chronic condition. It affects equally males and females. But according to some records, it is slightly more occurring in males as comparative to females. There are many classifications of symptoms of schizophrenia. Here I'm going to discuss about the three classifications, that is positive symptom, negative symptom, and Bleuler 4A's symptoms. Here, positive symptoms doesn't mean good symptoms, but it refers to some behavior that is lacking in schizophrenic. Hallucinations are false sensory perception which the person have in the absence of external stimuli, as we have seen in the given video section as an example. Next, with the delusions. Delusions are false fixed belief which a person have and the person doesn't want to give up or refuses to give when given factual information or given logical reasoning that the person is not right or his beliefs or his perceptions are not right. Next, bizarre behavior. That is strange, unusual behavior. For example, the person cries at a joke, the person laughs at a murder scene, etc. Fourth, conceptual disorganization. It can also be related to disorder of thought, in which the person makes irrelevant, incoherent, rambling speeches, or deverbalization becomes stereotypic in expression, means if the person is writing, he continues to write, the person is laughing, he continues to laugh, and showing bizarre, unusual behaviors. And the person can also show aggression, agitation, means throwing things at you, fighting with you, hostile behavior can be shown, means unfriendly behavior. Next, the person can have the feeling of grandiosity or a grandiosity delusion, in which the person have feeling that he's superior than everyone else, or the person can think that he's having a special relationship with some actor or president. The person is having some special relationship with the supernatural entities or powers. And then the person can have suspicious nature, means he doubts other, he's given logical reasoning, facts that the other person is not doubt-worthy, he should not be doubted, but the person doesn't agree. Now with the negative symptom of schizophrenia. Negative symptoms of schizophrenia doesn't mean bad symptoms, but it refers to the absence of normal behavior in an individual suffering from schizophrenia. For example, lack of pleasure or interest in life, lack of motivation, reduced energy, lack of emotions or expression, or showing emotions that doesn't fit the situation. For example, crying at a joke or laughing at a murder. Moodiness, catatonia, mood swings can also be there. Catatonia, it is a condition in which the person takes or sticks to a single position, takes bizarre postures. Have you listened to the news today? Do you know my aunt is very clever? I'm going to make a video on schizophrenia. Oh, the news I was talking about, China attacked India. So this is the first A of Bleuler's symptomatic classification, that is loosening of association, in which the schizophrenic person, he shifts from one topic to another randomly in an unfragmented manner without any relationship with pain. First A of Bleuler, that is loosening of association. Second A of Bleuler symptomatic classification, that is autistic thinking, in which the person gets stimulated internally, he is affected by fantasies, and he thinks his fantasies are real, and that's why he responds in that manner only, by taking his fantasies or internal thinking real. Third is affect disorder, in which the person mood keeps on changing or he doesn't react according to the situation. As I have told you before, the person laughs at the murder or he laughs at someone dying, etc. And the last 4A of Bleuler, that is ambivalence, in which the person is having two types of attitudes, emotions or feelings about a single object, person or place. For example, the person is loving one person and is hating the same person, means the person here becomes unable to take right decision. So these are 4 symptoms of schizophrenia. First is loosening of association, second is autistic thinking, third is ambivalence, fourth is affect disorder.